Excuse me. Is it all right if we get an interview with you for TokenTV.io? My name is Ken Nairhus.
Hey Ken, nice to meet you. Tom Giannulli.
Nice to meet you, Tom. Now, Tom, it looks as if you're a vendor here.
Yes.
What do you have going on for us?
So I'm with PatientDirected.io, and PatientDirected.io is a consumer-driven marketplace for healthcare information. So what we do is we work with a consumer to pull their information together from different silos, organize it, normalize it, increase the quality of that data, and then transfer the data back to the hospital, the payer, the medical device, the pharma company that needs it. And in that transaction, which is done on smart contract on Ethereum, the patient gets 90% of those revenues related to that transaction. So we help the patient collect information, apply their own governance to the information, how they want to share it, and then monetize it for their own benefit. And so we actually will help decrease healthcare costs, at the same time improve efficiencies in the system, and decrease costs secondarily via that means. And the patient really now has control and can monetize, which is two things they can't do today.
Right, so it gives them all the power, and it gives people, the doctors, the hospitals, all information all in one area.
Yeah, it gives them really good information they can use to make really good decisions, and they don't have to scramble to go get that information, and they get it very easily without a lot of complexity, which is the way it works today. It's very hard to get that information together.
So is it through payment, or is it just like I did a surgery and then that goes down on my history and then that goes into my personal blockchain or whatever?
All that information about any healthcare condition or management goes into our distributed system and normalized with other data like your wearable data. So you can actually build information that you don't normally do in the hospital. You have all this other information, genetic information. And then when I pull that as a provider doing a procedure like a surgery, I have a much better idea how to manage you, right? So I manage my risk by getting good data. And then when I pull that data, I pay for it, right? There's a fair market price for that data, and the patient then gets that money. So they can actually get it from providers, they can get it from payers, they can get it from medical device companies and pharmaceutical companies, even Google that wants to do a lot of analytics research and predictive modeling. They need good data. If the patient says, okay, I check it on their little mobile app, I want to do that, then they get the money for that. So it's really simple for them to manage it.
Awesome. So what made you decide to want to go down this avenue?
Good question. So I'm a physician by training. I'm also in the healthcare information technology space, and this is a really big problem. This problem has been around for 15 years. Even the government, Senate hearings have been held to try to make this problem go away, and the entrenched vendors that control the data, the silos, are not letting people have that data. It's for competitive reasons. They don't want to give up their competitive advantage, nor do some of the hospitals. But the payers and everyone else who's a stakeholder wants the data, especially the patients. And the only way to get the patient's data is to ask the patient to go get it for us. We do it for them, but we get their HIPAA rights to get the data. If I didn't use the patient to get the data would never be pushed out. So I'm using you, the patient, to benefit you. Just give me the rights to go get your data. I'll get it all, collect it all, and then I'll share it with everyone who needs to see it. But without me interacting in that way, we'll never solve this problem. And this is a pretty huge problem for healthcare.
Absolutely. How do people get a hold of you or get a hold of the information?
Very simple. PatientDirected.io is the website. So just come check us out there and we'll go from there.
All right, awesome. Oh, we have a question here. Yeah. So let me repeat this for everyone online. What token are you using in order to perform these smart contracts?
Right. So we're based on Ethereum today, and we'll probably keep it that way. We'll see how things develop. And so ERC20 token, which is called PTDIR, which will be minted soon. We're about 30 to 60 days out from minting that and offering it out as a Reg D security. So you can, as a qualified investor, participate in that offering.
Cool. So there you go. Do we have any more questions online or anything like that? Oh, PTDR. Does that make sense?
You might be able to find it on the if you scan the chain. It hasn't really been minted, so it's probably not going to be visible.
So what is PTIR or whatever?
PatientDirected, which is the name of the company. So.
That's the token's abbreviation. Oh,
exactly.
All right, awesome. Well, hey, thank you for your time. I really appreciate it. Is there a Twitter or any other handles that they can find you on?
Yeah, the PatientDirected is the Twitter handle as well, and we're on Telegram at Dr. Tom. That's my name, so you might hit me up on Telegram, or PatientDirected is also has its own channel on there as well.
Awesome. Well, hit up Dr. Tom, hit up PatientDirect.io, get out there, get in the crypto world. We can see how healthcare and crypto is now combining forces to make you healthier and to make our healthcare system more efficient. So you better watch out, because Bernie Sanders actually might get his wish through crypto.
Says, thank you, Dr. Tom.
Yep. Awesome. There you go. Thanks, Tom.
Follow us on Twitter at token_TV. Check out our website, tokentv.io. There you can join our emailing list, find links for our Discord channels and YouTube. We at Token TV Plus want to remind you that all the content presented in this show is for informational purposes only and should not be considered financial advice. Thanks for listening, folks, and we'll see you in the next block.